You're 63 years old, and you start having shortness of breath with lying flat. It gets so bad to the point that you have to sleep sitting up in a chair. You see your physician, and he orders a CT scan of the chest, which shows a 4.6 centimeter mass in your chest. The concern is for cancer. What do you do next? Welcome back to Montgomery Heart and Wellness, and we have an excellent clinical rounds case for you today. This is a 63-year-old lady who was diagnosed with a 4.6 centimeter mediastinal mass, and this was a PET CT scan. So tell the audience about this and this patient and what have you.
She's been a patient for a long time for initially coronary artery disease. She's had a heart attack stent and really worked pretty well on being plant-based since then, but then she developed a lot of orthopnea, and that means trouble breathing when lying down on your back. And so we did an echocardiogram, and we didn't see signs of, congestive heart failure to be a root cause of that.
As Camille mentioned, orthopnea is a sensation where when you're laying flat, all of a sudden you become short of breath and you have to sit up. In heart failure patients, the presentation is more, maybe you're laying flat and then you suddenly get short of breath lying up. Sometimes it's mixed in with just not being laid flat at all. And hers is more of a matter of as soon as she laid back to a certain amount, she gets short of breath, as I understand. Is that correct?
Yes, and she had to buy a special bed to try to be elevated all the time, but it wasn't comfortable at all for her.
Any form of shortness of breath, you look at, the cardiopulmonary system. So the next thing that was done, I think it was said, did we order this or did her pulmonologist?
Her pulmonologist ordered it.
Okay.
And that's where they found that large mass. And even though on the initial PET scan, it didn't have hypermetabolic activity, it's still a concern. You still need to watch any new mass.
Typically, when you see a mass in the chest, CT scan, the first thought that comes up is, could it be cancer? You do a PET scan, and a PET scan, you look for metabolic activity. They use a radionuclide tracer with a sugar-like agent to see if there's metabolism. So there wasn't any clear-cut metabolism, but that did not clearly exclude the possibility of cancer. So the typical thing is either to biopsy to get a more definitive diagnosis or give it a tincture of time. And so you may wait a few months and get another CT scan. And the hope is, say, in 3 to 6 months, the mass does not increase in size.
Right.
And I think this was the game plan with her. Is that correct?
Right. Her pulmonologist wanted to watch that, and because that was diagnosed in 2022, so they were watching it. And then she kind of came back to us more consistently in 2024. At that point, it still hadn't changed in size, but her symptoms were not any better, so she still wasn't having a good quality of life.
She wanted to be more aggressive in her lifestyle, so what did she do?
Yes, she did the raw detox, and she started exercising more during the day, and she actually could do that pretty well, walking on level ground. She felt her breathing was good then, but lying down flat was the initial main issue. But as she was detoxing, she began to notice she was sleeping better. And then a repeat PET scan was ordered, and that showed the mass reduced from 4.6 centimeters to 2.4. So that's a major reduction, and that explains why now she was breathing fine, lying flat on her back.
Yep. In fact, she was still sleeping in a special bed when she came to the clinic. So, well, I haven't really tried it yet, although she was having fewer symptoms with walking. I said, well, just lay flat on the exam table. She did 5-6 minutes, no symptoms. And that was the first time she had laid flat. And of course, the PET scan and follow-up didn't show any activity. So regression in the tumor size and no evidence of metabolic activity. And then more importantly, or I should say as importantly, she was better in terms of quality of life and reduction in symptoms. So that was a very, very important finding there. Now, Oftentimes, patients will ask, you mentioned detox diet. What are the details of the detox diet? We have a number of different detox regimens. You know, some people do juice feast, smoothie feast. She followed a food prescription approach. And in our book, we talk about the food classification system. And she was on food levels 0 to 4B. On 0 to 4B, she was able to eat foods that were not heated above, say, 130 degrees. And that was important, so it maintained the enzymatic activity. Some individuals who may have a more acute illness, we may have a lower classification rate. So we may describe it as a detox regimen in general, but when we work with our patient, we have a more precise food prescription approach. In my book, I talk about the food prescription for better health, and I outline this approach that we use. It's important because in her situation, even though she had significant symptoms, her diet had more flexibility because it was still a raw diet, but it had some dehydrated foods and it had a variety of things, as opposed to maybe some of our more acutely ill heart failure patients who are severely inflamed that may be on a more stringent nutritional regimen. So it varies. So her detox regimen was 0 to 4B, and she did it in a dedicated fashion. She also had some anti-inflammatory supplements. And so the mechanism of this is that you reduce oxidative stress, which is toxins in the body. You reduce inflammation. Inflammation contributes to swelling. So that mass could have been inflamed. And so the decreased inflammation mass could have led to the regression of the mass. So there are a lot of things that happen, you know, biochemically and physiologically that improves the overall health and well-being. So even though we had the mass as one thing we were watching, there were other things that were contributing to our overall health and improvement. So I just wanted to highlight that part for the audience, because oftentimes we'll say, yes, we had this finding, this great change, and she felt better. But there are a lot of different things that are happening, and there are a lot of different effects of this nutritional detox diet, which is really important.
It will be interesting to see in the future too, you know, as she stays more consistent with the plant-based and more raw type of diet. You know, she'll continue to lose more weight, and maybe, you know, that mass will go down more, we don't know. But as she reduces inflammation more, like you were saying, the swelling of that mass could continue to shrink.
Yep.
So that'll be interesting.
Go to 0 and make it become undetectable. And so these are the things that can be done where you allow the body to heal itself. And that's really the important thing. She nourished the body in a way, she removed toxic substances and allowed the body to heal itself. So another great case of a patient who's dedicated to improving her health. That's a great thing, and we hope to give you updates in the future. So as always, if you have any questions or comments about this situation, please leave them in the comment section. And until next time, take care. Thanks for watching. If you got value out of this video, please like it, subscribe, and hit the notification button to see our next